Hi everyone, this is Neil Writer, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with bilateral, fully occluding earwax. Just commencing with their left ear, which the patient felt was the worst one out of the two. However, it proved that the right one was a lot more difficult for me to remove, so do stay tuned for that. And the consistency of the wax between ears also differed significantly, and maybe in part that was one of the reasons why the right ear was a lot more difficult. The left ear was slightly soft, but nonetheless the wax was together. It wasn't loose. It was firm enough to bind together, which always helps. If the wax is too loose or sticky, when you suction it or try and remove it, it comes out in little bits and not in large lumps, so it can make it difficult to remove. You can see we've already cleared the majority of the ear canal. The patient's just got some wax in the inferior recess. So this region where I'm in now, we call that the inferior recess. As we approach the eardrum, the ear canal narrows. You can perhaps see that narrowing. Where I am here, the ear canal, you can see it narrows, it comes inwards. And then after it narrows, it widens again, and that creates a little pothole, if you like, a little recess where I was just getting that wax out inferiorly to the bottom of the ear canal next to the eardrum, and also to the front part of the ear canal, the anterior aspect near the eardrum. We call that the anterior recess. And I'm now just mopping up some wax, dead skin. So the wax plug that the patient had was enveloped in some dead skin. And you can see some skin here that's still attached to the ear canal. It's died, it's shedded, but it hasn't migrated. And we're right near the entrance. And we know we're at the entrance because you can see the hair strands. These hair strands that you can see, the little whiskers on the screen, they should only be located on the cartilaginous portion of the ear canal, which forms the outer third. The outer third of the ear canal, the cartilage portion, the layer of skin that lines it is your typical type of skin. It's got three layers. You've got the epidermis layer, the outermost layer. You've got the dermis layer, and then the innermost layer called the subcutaneous layer, which is a layer of insulating fat and connective tissue. And it's in the dermis and sometimes also the subcutaneous layer where you normally find the hair follicles. The ear canal deeper in the ear, the medial part, the inner two-thirds, the osseous portion, the bony part of the ear canal, the skin that lines the bony part of the ear canal doesn't contain the dermis, and it doesn't contain the subcutaneous layer. It only is lined with the outermost layer of skin, the epidermis. And that's why you should never really find any hair follicles or strands protruding on the bony part of the ear canal. So the left ear is done. Now we move on to the right ear, and this ear was a lot more tricky. The different consistency, the wax and dead skin, there's a lot more dead skin in this ear, the higher concentration.